I'm Dr. Phil Kieran.
And I'm Dr. Pixie McKenna. What can we do?
We'll be travelling around the country with our pop-up clinic and seeing patients with all sorts of health worries.
As far as
it goes.
Yeah.
Plus, we'll be bringing you advice on the latest medical developments,
Talk to me about bioidentical HRT.
so you know what you need to know to stay healthy.
This week, Phil tunes in to try and cure a hearing problem.
Can you hear the sound there?
No.
Nothing there, no?
No.
The doctors take some dehydrated Vikings to task with a pee test.
Was there a bit of a Viking hoolie last night?
There was.
And Pixie tries to understand why men are reluctant to take a simple test that could save their lives.
Someone's going to get you, even if it is a double-decker bus, you know.
The pop-up clinic is at Limerick's classic car rally. 25-year-old Emma Quinlan has come to see Pixie with a problem that's been causing her to cover up for over 5 years now.
So, Emma, why have you come in today? What's bothering you?
I've come in because I had these spots on my chest and a few on my back that were left over from chickenpox. I got the chickenpox when I was 20.
Oh, annoying when you get it when you're older, yeah.
Yeah, but at the same time, from a scar that you normally see with a chickenpox, these are lumps.
Okay. And what about the people that know you best? Do they say, look, they're fine, don't be ridiculous?
I suppose I've probably hidden the majority of the time from just about everybody. Like when I first met my boyfriend and the first time I wore like a low-cut top, I straight away started explaining what they were, so you wouldn't know that they were like big spots. You know, save the awkward question. I said, I'll just tell them straight away what they were.
Emma lives in Limerick with her boyfriend John.
People stare. You know, you're always in your head like, oh God, you're a waitress. Do they think you're spotty or something, like you're not, you know, clean or something like that? You know, there's always that worry. I get told to get on with it a lot, you know, but people don't seem to realise just how much it does affect your life. You know, from going out, like I can't just pick out a top out of the wardrobe and go out for a drink after work. I have to literally go through exactly what I'm going to wear. And it could take me 2 hours, so I don't even bother. But I do the odd bit of shopping online. So I always kind of look more stuff that's on a model that I can kind of work out where it's sitting and will it cover the spots. If it looks brilliant on me, but it doesn't sit high enough, you know, I have to send it back. I can't wear it.
You've been to your own doctor just the once, or?
I've asked 2 doctors, different doctors.
Yeah.
Different things have been said to me, so I just don't know what to do.
Well, look, it'd be really handy to take a look. Do you want to pop over here with me? All right, just through here, Emma. You're well buttoned up today, aren't you?
Yeah, I have indeed. I always kind of keep it covered, yeah. Well, I have plenty of shirts.
Okay, right.
Yeah. Pretty much see them straight away.
Yeah. 2 there. And let me just have a little look at the back. Okay, not so bad in the back, but still relevant enough for you to...
Keep covered.
Yeah. With chickenpox, you do tend to get scarring. It can run in families. So there may be a tendency within your family to get this type of scarring. It's almost like super scarring, okay? For some reason, it gets very embedded and it makes a scar that's bigger than the actual wound.
Okay.
So it goes beyond the perimeter of the pox, essentially. What can we do? You inject in here and here, so you use steroid injections, and that usually flattens them and also in some way lightens them. I would probably be looking at some type of camouflage makeup. I think that would be the next step.
We all love a bargain. And if someone offered you something that could potentially save your life, you'd take it, wouldn't you? Especially if it cost nothing.
And that's just what thousands of women have done with the free breast cancer and cervical screening programs, which have seen a huge take-up rate of 80% and 90% respectively.
Well, But it's a different story when it comes to the bowel cancer screening test. Just over 1/3 of men who were eligible actually took the test. That's despite the fact it's free, it can be done in the privacy of your own home, and it's potentially life-saving. So why are men avoiding the test?
Pixie has come to the Men's Shed Club in Ballantyre in search of answers. Many women have been tested. Just what is it that makes men so reluctant to take this free, potentially life-saving test?
I got the letter in the door actually last year, and I looked at it and now I should have been more aware of it because both my mother and my father died of cancer. Okay. But at the time when I got it in the door, I said, sure, everybody's getting these things. I just rolled it up and put it in the bin.
Am I afraid of finding out something that I don't want to know about?
I think there's that.
Yeah, do we live in ignorance like
There
this?
is a fear factor.
Yeah,
I
fear
think a lot of men have a fear factor. They don't want to know that there's something wrong with them.
Someone's going to get you, even if it is a double-decker bus, you know.
Very optimistic.
The whole point of the screening test that you do through the post is checking men aged between 60 and 69 for blood that you can't see in the bowel motions, which might be an indication that there's trouble ahead. So not maybe trouble right now, but trouble 3, 4, 5, 6 years down the line. And therefore it's catching that before it becomes a bigger problem.
Pixie's determined to convince even the most reluctant of the Men's Shed group to take the test, and she's happy to demonstrate what needs to be done.
So, home test kit, instructions. You go into the bathroom and then you make kind of like a little nest of toilet paper so that it catches the bowel motion when you deliver it, all right? Now, for the purposes of the demo, we've got some chocolate spread. Yeah, you'll never eat it again. There you go. Now, we're just gonna ensure that the bottom of the stick is covered. And then you're gonna put the stick back into the tube, and you don't have to pay for the post or anything. It all goes straight into the post box. Does it seem like such a tricky thing?
How long do you have to wait after sending off the sample for a response, whether it be positive or negative?
You have to wait about 2 weeks on average.
Okay.
This is a simple test that is free and potentially life-saving, but only if you take it. So if you're aged between 60 and 69 and you want to check your eligibility, go to bowelscreen.ie.
The general noise and merriment at the Irish Maritime Festival in Drogheda is a muted experience for 52-year-old Martin Rikers. He's come to the clinic to see Phil about a hearing loss problem that started 7 months ago.
You've always had problems with your ears on the plane, is that right?
Yeah, when the landing sets in.
Okay, you're okay going up?
Yeah.
Not coming down?
Yeah.
Okay, you felt pain or pressure in your ears?
Really soreness, the whole around the ear here.
Okay.
But there's a muffled sound, and then if I press on here, it's a crunching noise in the ear.
In the ear?
Yeah, well, the left is fine, the right give me really bother.
Martin is from the Netherlands via Bundoran, where he's lived for the last 16 years.
It's already seven months ago. We're flying from Amsterdam to Belfast, so it's not really a long flight. And my head will be really, really sore because my ear didn't pop. And like you're swimming on the water and somebody's talking out of the swimming pool. And I do teaching, so I do woodwork, brickwork, painting, decorating, but speaking to students, especially the ones with special needs. It was really annoying for everybody involved because the students have to repeat everything and have to ask over and over again. So if you work with the machines with the background sound, it can be very confusing, disorientating a little bit. And I have the feeling sometimes that some of them take it personally because that ignore them, which isn't the case, of course, but something that can happen. So that's a major problem for me.
I went to the doctor and he checked my ear there and he gave me the first, it was antihistamines.
Okay.
Done it for a few weeks, didn't work out. Went back, then he gave me antibiotics.
Okay, yeah.
Didn't work out either.
Do you have any symptoms in your nose at all? Any congestion or runny nose? No. And if you pinch your nose and blow, does that pop it and nothing happening at this stage? No.
I've done all the tricks in the book.
Yeah, and it's not settling
No,
down.
it doesn't. No.
Okay. Well, I think at this stage we need to have a look at the ear and see what's going on. So I might bring you through to the back here, if that's
fine.
all right. Just come through with me here. It's the right ear that's the problem, is it? Yeah. Okay. Can I ask you to pinch your nose and blow out for me there, Martin? And nothing happening there, no?
No.
Can I get you to pinch your nose and swallow for me? No, nothing there either. Okay. Where's this crunching sound now, Martin? Is it
Here.
just there? So when you press there, you get a crunching
Press
sound.
there, you really hear a crunching noise in all that area.
In that area.
It's in there.
Okay. Do you hear a sound there?
Yeah.
Can you hear the sound there?
No.
Nothing there, no?
No.
Can you hear it there?
Yeah.
Okay, okay. It sounds to me that you've always had a bit of trouble getting your ears to equalise. You've got a tube that goes down the back of your throat called your eustachian tube is the name of it. And when you yawn or chew or blow your nose, the idea is that that opens up and allows the pressure to equalise, and that's that pop you feel in it, right? And so you probably have quite narrow tubes at the back of your throat.
The eustachian tube is in the middle ear. It helps restore equilibrium during changes in pressure. When blocked, symptoms can develop which include ear pain, nosebleeds, hearing loss and eardrum injury.
Have you ever used a saltwater rinse that you rinse out the back of your nose with? It feels a lot like turning upside down in the sea. It's not the most pleasant thing in the world, but what it can do is it can clear out the back of the nose and throat, and it can reduce some swelling in the lining there, and that may actually open up the tube and let the ear pop, okay? And then if that's not settling, to see a specialist.
Fair enough.
All right?
Okay.
Dr. Pixie McKenna and Dr. Phil Kieran are travelling the country in their pop-up clinic, meeting people with all sorts of health worries.
Can you hear the sound there?
No.
Earlier, Martin Rikers came to the clinic with a hearing loss problem caused by flying.
We all know how uncomfortable it can be when your ear won't pop if you're coming down on a flight. But imagine if that went on for weeks and even months. In extreme cases, this can cause significant hearing loss, which can be very difficult to work with and even to put up with on a day-to-day basis. If it doesn't settle, on occasion you will need surgery to allow that pressure to equalise.
Phil has sent Martin home to try a method of saline nasal rinsing. If this doesn't work, Phil will refer him on to a specialist. Saline nasal rinsing can be used to try to clear out the eustachian tube. A home kit with warm water and saline solution flushed up the nose twice daily is recommended. Saline sachets can be bought over the counter without a prescription.
I put the bottle then in one nostril, flush it out on this side, blow it out, clear it out, and then I do the other side again.
Back in Drogheda, 44-year-old Mark Kelly has come to see Phil about an injury picked up at a five-a-side soccer match.
Do you mind if we take a look at it and see what's going on there? Can I get you to take the t-shirt off? Can you point with one finger to where it's most painful?
It's in and around. It's in around there.
In and around there?
Yeah, just
okay.
there, yeah.
Okay, just relax there as much as you can for me now. Any pain when I press there?
Slight pain. Yeah.
Slight pain. It's around about that.
It's
that neighbourhood, is it?
Just there, yeah. You got
there.
it there, yeah. It's a sort of sharp pain.
You put the arms up like this for me. I'm going to push your hands apart. I want you to hold them where they are, okay? Yeah. Any pain doing that?
Little bit, but
nothing dramatic.
Nothing extreme, yeah.
You've done one of two things. You've either fractured the rib or else you've bruised it quite badly, right? There's not a lot you can do about it, and it stays painful for up to 3 weeks, okay? One of the big things with any rib injuries, though, when your ribs are sore, you have a tendency not to take deep breaths because it hurts. And that puts you at a very high risk of getting chest infections.
Okay.
So if you have a rib injury or chest injury like this, one of the things that you need to remember to do is about 3 times a day, concentrate on taking 10 big deep breaths in and out. Really fill out the bottom part of the lungs.
Rib pain can restrict breathing, reducing air movement through our lungs. This can allow mucus and phlegm to build up, increasing the risk of chest infection or pneumonia.
If you need to take some paracetamol or ibuprofen beforehand to do that, then do it, because it'll reduce your risks of getting a chest infection. A lot of my patients would ask, but if it's broken, do I not need an x-ray? And in this particular case, absolutely not. If it's not going to change what you do, there's no point in getting a scan.
25-year-old Emma Quinlan came to the clinic with scarring caused by chickenpox. Pixie has referred her to Dr. Naomi Mackle, a GP with a special interest in dermatology. Emma's hopeful that some kind of improvement can be found that allows her to feel more confident.
They're called hypertrophic scars. So sometimes you get them from acne, sometimes you get them from chickenpox, okay? And they should just heal normally, but your body has overreacted.
A hypertrophic scar is formed from overproduction of collagen, giving rise to a raised surface containing nerves and blood vessels. These scars also form from pimples, body piercings, cuts and burns.
Generally what we do here, we inject the scar with the steroid. The results you'll get will depend on how easy it is for me to inject into it. So I'm going to start injecting now. So that one went in easily. Do you remember I said to you some of the small ones will respond very well, but a bigger one might be a little bit more difficult. How are you finding that?
That's a bit pinchy.
Yeah, sorry. Sorry. So it's exactly the same procedure around the back now. Those smaller ones now, I reckon you'll get a super result even from one injection. No, I'll just put a bandage on. Are you okay?
Oh, really? Stop.
Oh, really? Apologies, sorry. They're lovely and soft to inject for me, so it means the steroid's gone right into it. I keep it covered, just say until tomorrow, and after that you're fine to take the plasters off.
Emma now has a 6-week wait to see how effective the steroid treatment has been. The recommended healthy intake of water each day is 6 to 8 glasses. A recent study suggests that a staggering 86% of us are not drinking enough, which means that many of us are dehydrated. Victory! At the Waterford Country Fair, Pixie has invited a gang of pillaging Vikings to pee into a pot to check their hydration levels.
Dehydration can be a major contributor to constipation, headaches, and even kidney stones.
It's not unusual to go to the doctor and be asked to provide a sample of pee. We can tell an awful lot by testing it. But even without fancy medical kit, you can tell how hydrated you are from the privacy of your own bathroom.
Now, let's see those samples, guys.
Wow.
A big range of colours there, isn't there, Pixie?
Good variation, yeah. Would you ever eyeball the colour of it or anything like that?
First thing in the morning, really, with me.
Yeah.
And would you know what sort of colour you should be aiming for?
Clear, or as close to clear.
Yeah.
Pale champagne.
Pale champagne, I like it. Is that a particularly common drink for Vikings?
Luckily, we have a chart here.
That's not
Quite
pale
dark.
champagne.
No. Quite dehydrated.
Yeah, you're dehydrated.
If your pee is the colour of champagne or lighter, you're well hydrated. Darker than that and you need to drink more. Mild to moderate dehydration can cause dry mouth, tiredness, headaches, dry skin, dizziness and loss of strength and stamina.
I'll just get me coat.
Were you out last night, were you?
Starting to see a pattern here now.
Was there a bit of a Viking hoolie last night?
There was.
There's lots of tea drinking.
Some of us went to bed earlier than the others.
Good
It's a bit
woman.
better, yeah.
No, she's much better though, isn't
Yeah.
she?
Thank you.
Anyone else? Any more samples for me?
It's a healthy sample.
A sizable sample.
Yeah, sizable man.
Bit of middle of the
down,
road,
yeah.
are we?
There, maybe.
Yeah. So, much like a lot of my reports from school, good, but could do better. Particularly with strenuous physical exercise like you guys are doing, you should be trying to drink about a pint of water at least for every hour of exercise. And best of luck with your battles.
Thank you. Would you like to join us?
I feel I would be killed very, very quickly.
In Bundoran, Martin has been rinsing twice daily with a saline solution to try and cure his loss of hearing, a problem he's had for some 8 months now. Phil checks in to see if this simple treatment has had any effect.
It's good to see you again, Martin. How are you getting on since the last time I spoke to you?
Not too bad. The nasal rinse is working, definitely.
And have you done any flying since I spoke to you last, Martin? Because that was a big problem the last time I spoke to you.
I had to fly during the summer holiday we went away, and it was grand. There was no problem whatsoever. No pain in my ears. Nothing.
That's fantastic.
It is good. I'm chuffed a bit.
Because you're a bit prone to this problem with the ears, it may be that you need to use this from time to time long term to keep it at bay.
Thank you very much. Much appreciated for all your help. Thank you.
Bye-bye.
See you. Bye-bye.
Emma has raised scars caused by chickenpox. 6 weeks ago, she had steroids injected into her scars to flatten them. Today, a volunteer from the Irish Red Cross Skin Camouflage team is calling to Emma to show her how camouflage makeup can work for her.
So at the end of the consultation, you will go home and you will be the expert in how to put on skin camouflage cream.
Camouflage makeup is a specialised cream, medically developed to cover conditions such as vitiligo, rosacea, scars and burns.
Over here this way. Okay, so we're going to do a colour match first. You know, I've done up to 10, 15 colour matches on people, or sometimes you can take 1 or 2, so it's all depending. First. How do you feel the steroid injections went?
Really well. They've really flattened. Like they still have a bit to go, but there's a major difference.
Brilliant. You can turn around to the light if you need.
It's quite pale, but it is close. It is pretty close and it's covering it well.
Okay, we can try another colour. So we can try this one here. So maybe see how that one is and turn around to the light.
Yeah, that one's very good. I think it just sort of blends a little bit better.
So you happy to go ahead with this, or would you like to try another one?
I'm happy with this one.
Okay, this is the part where I teach you. I'm going to do what we call hatcheting technique. So it's doing a crisscross. You can be quite generous with this cream also. So this is one covered. I'm going to put the setting powder on this.
And how long would this makeup last?
This can last up to 2 or 3 days once applied. And once we use our special setting powders as well, it can be waterproof too. So it's about 8 to 12 hours on the face and about 2 to 3 days on the body, okay? So now I'm going ahead and I'm going to just brush off that excess powder.
I think it's amazing. It's brilliant. You can barely see that it's there.
The Irish Red Cross run free skin camouflage clinics around the country. You can find out more information at redcross.ie.
I'm not going to have as many stares, I suppose, which will help a lot. Like, you know, confidence was knocked for a while there, you know, with those spots, and everybody could see them and everybody was wondering what they were. But now, you know, I can cover them. Nobody has to see them. It's brilliant.